Ladies and gentlemen, good afternoon. Firstly, thank you to Philip Pike for the invitation and opportunity to speak to you today. It is indeed my pleasure. I've been asked to speak on a couple of subjects. Firstly, about my medical journey, and then about organ donation. And so to my story. Up until the age of 14, I was a perfectly healthy country girl, growing up on a farm near Manila, 35 kilometres northwest of Tamworth. My medical history was unremarkable, comprising of an ingrowing toenail and 3 stitches to my knee. I'd never had a blood test, and I'd certainly never been in hospital. How quickly things were to change though. In March 1984, I presented to my GP, initially with a fever. A course of antibiotics was prescribed, followed by another, but there was not much improvement. 2 weeks went by, and I went back to school, but boy, was it a struggle. That was the only week of my schooling I was guilty of visiting the library both at recess and lunch, but my motive was not to study. It was to find a corner out of view of the librarian into which I could curl up and sleep. At the end of the 3rd week, I went to my GP again, still feeling pretty dreadful, and I'd started to have breathing difficulties. I'd also started to vomit, though I had the vague idea this had something to do with my mum's sweet and sour pork. My GP found that I had a very rapid pulse rate, my liver was tender, and my blood pressure was extraordinarily low. And so I was admitted to Tamworth-based hospital. I was in end-stage heart failure, and within 12 hours it was arranged that I'd be transferred by air ambulance to Sydney's Royal North Shore Hospital. My school friends came to visit before I left, and I assured them that I was just going to Sydney for a few tests. But I can remember being very excited because I was going to be flying to Sydney, and I'd never been on a plane before. I was innocent and blissfully unaware of the severity of my situation. After arrival at Royal North Shore, it wasn't long before the diagnosis of viral myocarditis was made, which resulted in me also being in liver and renal failure. My heart had enlarged enormously to the extent that I had collapsed and punctured lung from the pressure. By this stage, I was unconscious, on ventilation, and an intra-aortic balloon pump pumping my heart, peritoneal dialysis for my kidneys, and anything up to a dozen IVs. And the Royal North Shore intensivist, Dr. Ross Wilson, decided I needed a heart transplant. Understandably, I suppose, a rapidly deteriorating 14-year-old was not the candidate the recently formed St Vincent's heart transplant team necessarily wanted as their second patient in their new program, and I was categorised as unsuitable. Ross Wilson then had to consider what other options he had. It was decided that transfer to Stanford in the USA was probably my best chance. However, it soon became clear that I was in no condition to make that flight. As a last resort, Ross personally phoned Dr. Victor Chang and asked him again to please come over and have one last look. Dr. Chang came. He sat by my bed. He spoke to my parents, who, as you can imagine, were beside themselves. They assured him that I was made of good country stock and I was a fighter, and they would do whatever it took to help get me through whatever might lay ahead. It was rare a patient has such an operation without thorough psychiatric assessment to ensure they have the temperament to cope with what may lay ahead. Happily for me, Dr. Chang finally agreed and put me on the waiting list. But he stressed they only had days in which to find a donor and perform the transplant. In 1984, this was brand new territory for everyone. A press conference was called by Dr. Wilson, and as it was unethical for St Vincent to do such a thing, and a plea for a donor heart was made by Royal North Shore and my distraught parents. Incredibly, 2 donations were made, and 6 days after arriving in Sydney, I was prepared for transfer to St Vincent's Hospital for my transplant. The transfer itself was also not without its problems. Moving a patient with an intra-aortic balloon pump across Sydney was anything but routine back then, as ambulances didn't have an independent power supply. The ever-resourceful Ross Wilson improvised, and he put together a series of car batteries to power the pump, and I was set to go. They had worked out they had a maximum of 13 minutes to get me from intensive care in the northern suburbs across the Harbour Bridge to theatre at St Vincent's. They made it in 11 minutes. Upon arrival in theatre at St Vincent's, I promptly arrested, and it put even more pressure on poor Victor and his team. They must have wondered what on earth they'd taken on. Fortunately, the surgery went well, and I was cared for in the strictest of barrier nursing to hopefully avoid any external infections that may take hold of my severely weakened body. Interestingly, even after I was finally taken off the ventilator, I hadn't thought to ask exactly what had been done. I was satisfied with the thought that I'd simply had a heart operation. Some 3 weeks later, in my sterile critical care room, when I saw my face on the TV news, it was the leading story of the bulletin, and as you can imagine, I was very surprised. The volume was switched down, and by the time I found the remote control, the next story was being aired. To say I was shocked and puzzled was an understatement, and the poor nurse was quickly calling for Dr. Chang to come and explain things to his patient. He arrived, and I was pretty keen to know what was going on. Victor had explained my critical state of health and the ensuing heart transplant, rejection issues, and pneumonia, to name a few. I was pretty angry that he had kept such a secret. With copious amounts of drugs on board, this normally shy girl became very assertive, and poor Victor was in trouble. Of course, things cooled down very quickly, and our relationship developed from there. The fact was that prior to this, I had been reasonably oblivious to who this person was, who regularly called by my hospital bed. Those were early days, and Dr. Chang told my parents that in fact the surgery was the easy part. Now the difficult part was handed over to one of the physicians. No one other than a junior surgeon on the team, Philip Spratt, had any real experience looking after transplant patients. Phil having done a year's training at Papworth Hospital in England. Within the first week, I had pneumonia and severe rejection, and so the phone calls to England began, seeking advice on what on earth they do next. Dr. Spratt didn't leave my room for the first 3 days. My normal 50 kilogram frame had reduced to 30 kilograms, and I was quickly taking on the appearance of a human pincushion, with blood gases being taken much too often for my liking, and cardiac biopsies every 4 to 7 days, a procedure I hated. After much testing and monitoring, I was discharged from St Vincent's after about 100 days post-surgery. But they didn't let me go too far. I spent the next 4 months living a block away from the hospital so they can continue regular treatment. At long last, I went back to the farm and life continued with my schooling the following year. Eventually, I was allowed to start a swimming program and swam about 1 kilometre 6 days a week for exercise, and my family and I were amazed at how well I was doing. Although with hindsight, the telltale signs of rejection, namely swollen ankles and breathlessness, were never too far away, and the reality was I was struggling. 18 months post-op, and my doctor told me I needed another transplant. I spent the next 3.5 months in and around St Vincent's prior to my second operation. There were lighter moments during this time, and I had much fun with 3 young guys in the program who were in a similar position to myself. There was certainly no such thing as confidentiality amongst this crew, but regardless, we were firm friends. They were unmerciless in their ribbing and taunting, but I gave as good as I got. Time marched on and I became very sick and was prepared for surgery. Strangely, I had severe abdominal pain nobody could explain, and it was decided to do exploratory abdominal surgery. And then, if all was okay, they would continue and transplant my second heart. The transplant went ahead. Dr. Chang opened my sternum in the usual manner and slashed through my right atrium, and the fun and games began. It was a mess. Now, a now widely known fact is that transplanted hearts often attach to the rib cage, and that therefore makes any further surgery very tricky at best. When I woke, I felt like I'd been hit by a bus, but I could feel that my heart function was much better, and I definitely knew what they'd done this time. At that time, my biggest challenge was cooperating with the physio and her continual requests for me to cough. I just didn't have enough hands to hold all the bits that hurt. My second transplant was incredibly difficult, physically and emotionally. Two of the young guys I'd become friends with died suddenly a week either side of my transplant, and everyone was absolutely devastated. And then, out of the blue, a staph outbreak at the hospital saw the two recipients just before and just after me also die. I was terrified, and Dr. Chan was very keen to discharge me as quickly as possible. When my outpatient period was over, at the grand age of 16, I decided I wanted to remain living in Sydney, close to St Vincent's, and not return home. My confidence had been shattered, and I needed the security of medical backup close at hand. However, with each passing year, I gained assurance in my health, and I have had mostly very good health up until recent years. A couple of years ago, I had a valve replacement. My doctor said to me as she was discharging me, she said, "Well, that just made your two transplants look like a walk in the park." Needless to say, it was a torrid time. I was in hospital for about 5 months, and I won't bore you with the detail. Looking back at my journey, there were many things that fell into place. And obviously I had the skills of a few incredible doctors. Victor Chang always said to me, it was Ross Wilson I had to thank, not him, because what he did in the 6 days I was his patient was remarkable. I was in total organ failure, but I didn't have any infection in my body, which meant I could therefore have a transplant. And Ross Wilson persuaded Dr. Chang to operate on me, which was no mean feat. From an organ donation perspective, there were a few things that were key. Firstly, I had a common blood type, A positive, which back then was very important. Secondly, I was a patient at Royal North Shore Hospital, and that meant that they could do a donor plea on my behalf. Had I been transferred from Tamworth to St Vincent's, that would not have been possible, as it was considered unethical. The third thing was timing. The transplant program had just commenced. They had done their first transplant 6 weeks prior, and it was Easter. So how fortunate I was to live at a time when transplantation was possible. However, it is not just about the skill of the doctors who perform the procedure, albeit that is incredible. It is very much more about the fact that there is enough love in the world that allows families at a time of unimaginable grief to make a decision to donate their loved ones to another person. So a stranger, someone they likely may never know, has the opportunity to live, as I have on 2 occasions. It is the ultimate altruistic gift we can bestow as we leave this world, and it can and does make such a difference. My life has been greatly enriched by my transplant journey. The obvious is that it has been life-giving and life-changing, but it has been more than just about my health. It has shaped the person I now am. One of my greatest privileges has been meeting many donor families over the years and being privy to their stories. A few years ago, after a speech I gave in country Victoria, a woman quietly came up to me and related how her daughter had been fatally injured on her 18th birthday in a car that she and her husband had given her as a present when her drunk boyfriend insisted on driving. The devastated family were approached regarding organ donation. They had actually spoken about it the week before. And so whilst she admitted that she and her son were very opposed to donation, they honoured her daughter's wishes, and 6 recipients benefited. With tears in her eyes, 23 years on, this mum told me how our meeting had helped her grasp the enormity of what their donation meant. She left delighted with her photos of us together, looking forward to sharing her renewed pride in her daughter's donation with her still grieving family. Organ donation and transplantation journeys are truly remarkable. They are essentially stories about families, the donor family and the prospective transplant recipient family, who themselves could so easily be in a position of mourning their own loss. Often there is only days in it. I urge every family to discuss organ donation and express their wishes, be they positive or negative, so that their family are empowered with that knowledge, should the unimaginable occur. The selfless act of organ and tissue donation, apart from obviously giving life, deeply enriches the lives of those fortunate enough to be the recipients of such treasures. It changes lives forever, for them and all those who love them. Life is somehow sweeter. I'm not sure if it's experiencing the lowest of the lows that then gives greater emphasis and appreciation of the highs that follows. I'm just thankful to be one of these blessed individuals, and I hope in years to come I can return the favour. Thank you.